2 years since the tragic Humboldt Broncos crash. From coast to coast to coast, we remember the 16 lives that ended much too soon and the many more that were changed forever. If you lost a friend, a teammate, or a loved one, if you're still rebuilding and recovering, I want you to know that we're here for you, and we will always be here for you. You, the community of Humboldt, along with all Canadians who stand with you, have shown incredible strength and resilience. And just like the people putting out hockey sticks or wearing the jersey, you remind us that together we can get through even the darkest of times. Right now, as we face a challenge unlike any other, we lean on our friends and family, and we let them know that they can lean on us, too. The weeks and months ahead won't be easy, but we're going to get through this together. I'm sure many of you watched the Queen's address yesterday afternoon, and her message of unity and resolve is more important than ever. No one should feel alone in this. No one should wonder how they'll weather this storm without support. Over the past few weeks, we've brought in a whole range of new measures to help families and workers, seniors and business owners get through this. Taken together, we've introduced the biggest economic measures in our lifetime, which will help millions of people. That includes the Canada Emergency Response Benefit for if you've lost your paycheck. Whether you're taking care of someone who's sick, have been laid off, or are living with a disability, the CERB is there for you. This benefit is now available starting today. If you're born in January, February, or March, you can go to canada.ca and apply online. If you can't apply online, don't worry. You can call 1-800-959-2041. Since it opened this morning, 240,000 people have already successfully applied. For everyone else, you'll be able to apply another day this week, depending on your birth month. We know you need this support as soon as possible. We have to make sure the system works for everyone. If you're using direct deposit, you'll receive money 3 to 5 days later. The CERB is meant to help all Canadians who need it, and millions of Canadians will be getting it starting this week. There are some people who don't yet qualify who we do need to help. If you're working reduced hours, down to 10 hours a week or less, we will soon announce how you will be able to qualify for the CERB. This is to help you if you're a gig worker, a contract worker, or a volunteer firefighter. We'll also have more to say for those who are working, but making less than they would with the benefit. I'm thinking in particular of home care workers or long-term care workers looking after vulnerable seniors. And I know there are also lots of university or college students wondering what kind of job you'll get this summer. You need support now, and work is underway to get it to you as soon as possible. For people in all of these situations, we see you. We're going to be there for you. And we're working as hard as we can to get you the support you need. At the same time, we also announced a new 75% wage subsidy to help you keep your job and help businesses keep their employees on the payroll. Right now, we're drafting legislation and talking to other parties ahead of bringing Parliament back to put the wage subsidy in place as quickly as possible. Supporting you and your family is our top priority. Your Minister of Finance, Bill Morneau, will have more updates soon, but here's the bottom line. Whatever your situation, we are working to get you the help you need.
If you're born in January, February, or in March, and you had to stop working due to this virus, you can make a request for the Canadian Emergency Benefits starting today on canada.ca. If not, you can go and submit your request later in the week based on your birth month. You are numerous of needing quick help, and we need to make sure that this system works for everyone. If you opt for direct deposit, it should take about 3 to 5 days to receive a first payment. The emergency benefit aims to help all Canadians who need this extra help, and I know that a few people need support and are not yet eligible. If your working hours have been reduced by 10 hours per week or less, we will announce soon how you can benefit from this special help. We will news also for those earning less money that if they were getting the benefit. I'm thinking about home health care people or those taking care of our elderly. Many students in CEGEP or in university are wondering what they will be doing this summer. It's clear that you also need help, and we are working hard to find solutions. At the same time, we're working on a bill and collaborate with opposition parties to gather the Parliament and put in place measures that we've announced as quickly as possible. The Minister of Finance, Bill Morneau, will have more details a bit later. But here's what we need to remember. Whatever your circumstances, we do everything we can to help you. We're working really hard to give you a little break and help you manage your financial situation. Banks have an important role to play because they will be able to help businesses to continue their activities and families to pay their rent and mortgages. I want to salute today the decision of the 6 large banks and a few cooperatives to reduce about half of the interest rates for credit cards for Canadians going through financial hardships caused by this pandemic.
And of certain credit unions to cut credit card interest rates almost in half for people in financial difficulty because of the pandemic will give them much needed relief on debt. I also want to thank Minister Morneau for his outstanding leadership on this. And we need to see even more action like this going forward, because this is a time to think about each other, not about the bottom line. On that note, I want to recognize the new initiative the Canadian Chamber of Commerce launched in partnership with our government. The Canadian Business Resilience Network will help businesses of all sizes get through this tough period, not just get through this tough period, but drive our economic recovery afterwards. This builds on what we've already done to help business owners. We have a 3-point economic plan. It supports business owners, including through new loans, while safeguarding jobs with the wage subsidy and helping those who no longer have a paycheck with the CERB. We're here for you. In order to get through this and keep our loved ones and our frontline workers safe, all Canadians need to do their part. Don't forget that you are shaping our future today. What the next weeks and months look like depends on you. It depends on whether you stay home, whether you help protect the vulnerable and make sure our hospitals aren't overwhelmed. Chaque citoyen.
Every citizen must do its part because people who need to continue to go to work, nurses, doctors, ambulance staff or paramedics, lab workers, grocers, and farmers and truckers do more than their part. They make sacrifices for the rest of the population to stay home. The best way to thank them is to continue to follow the directives from our health experts. That's how we can all protect our health and theirs. Thank you for being with us today.
Merci beaucoup, Monsieur le Premier ministre. On va maintenant passer à la période de questions en commençant par le téléphone. Modérateur, c'est à vous.
Thank you. Merci. The first question, Alex Ballingal, Toronto Star. Line is open.
Good morning, Prime Minister. Premier Ford in Ontario reportedly told City News this morning that Ontario could run out of personal protective equipment within a week, and that the U.S. has stopped a shipment of equipment last night. I'm wondering what your reaction to that is, that impending shortage in Ontario? And can you tell us if the U.S. has actually stopped any shipments of goods into Canada?
We are working very closely with all provinces and monitoring the levels of personal protective equipment and the challenges they're facing both on procurement and on making sure that our health officials, healthcare workers across the country get the kind of help that they need. We continue to have productive and positive conversations with the United States, emphasizing for them that healthcare supplies and workers across the border are very much a two-way street, and we need to continue to enable us to be there for our neighbors because it's in our collective interest. Minister Champagne had a good conversation with Secretary Pompeo this morning. Those conversations are continuing, and we expect those supplies to be delivered. Depuis le début, nous travaillons.
Since the start, we've been working with the provinces' premiers to make sure that they have all the necessary equipment to protect the healthcare workers. We're really conscious about the worries that some people have of missing equipment in the days and weeks coming. That's why we're working really, really hard to get supplies from across the world, but also to start producing these here in Canada. I can underline that we are continuing to have those very productive discussions with Americans, including Minister Champagne with Secretary Pompeo this morning, and we're expecting for those products to be delivered.
Follow-up question?
Have you, I guess just to repeat that question has there been any shipments that have been stopped that we were expecting to get? And have you received any assurances from the Americans that they will allow these to go through?
As I said, there are very productive conversations ongoing, and we expect those shipments to be delivered.
Thank you. Next question.
Thank you. Merci. Next question, Jim Bronskill, the Canadian Press. Line is open.
Good morning. We're wondering if you can update us on any of the efforts to ensure that people are quarantined who need to be quarantined. Do you have anything to tell us today about whether anyone has been quarantined? And if so, are there any numbers on that score? Thank you.
Anyone returning to Canada is subject to a mandatory quarantine order. That means they have to go straight home from the airport and stay home for 14 days. Public health officials are following up with a number of those people, particularly some of the higher risk or challenging cases. We are confident that Canadians right across the country are obeying the quarantine orders and making sure that they're doing everything they need to do to keep themselves and their loved ones safe.
Follow-up question?
Is there any sense beyond the normal quarantine procedures whether the Quarantine Act has been invoked in special cases and people have actually been forced into quarantine in centers or other locations under the Quarantine Act?
From the very beginning, there was a number of measures that we took on returning flights from Wuhan, for example, on flights coming back from various cruises where we had mandatory quarantines in centers. We have facilities available for people who are returning to Canada and for various reasons cannot quarantine themselves at home or home is too far from the airport. That is why we have institutions in place, and those are being used.
Merci beaucoup. Prochaine question.
Thank you. Merci. Prochaine question, Raymond Filion, TVA, à vous.
Oui, bonjour, Monsieur le Premier ministre. Vous avez dit il y a
Mr. Prime Minister, you said over a week now that you were on a new countdown in terms of the end of your self-isolation. Can you tell us at what point this countdown is coming to end and when do you want to go back to your office?
I
want to go back to the office in the days coming, but My job will mostly happen from home. We acknowledge that that's what we're asking to everyone, to stay at home, if possible. And as we demonstrated for many weeks, we can continue, and we work really well from home in this particular situation. And of course, there are possibilities that I go to the house or to the office in the days and weeks coming, but in principle, I will continue to work from home as much as possible. You also mentioned in your speech earlier today that the weeks and the months coming won't be easy. Can you elaborate on this? I understand that the CERB depends on the people's decision and behavior, and that data will come out soon, but what does it mean concretely, what you just said? What it means concretely is that people should expect to continue to stay at home for at least many weeks and many months. And we will have more precise answers as we create models and predictions or projections that will give us more an idea of how it will come. But every prediction, every projection, every model gives us a large variance, depending on the actions that you can take as individuals, as a society. To stay at home, to continue this isolation period and distancing period is the best way to get out of this as quickly as possible. But as a matter of fact, it will be an issue of many weeks and possibly many months, a few months.
Thank you. Merci. Dernière question, Marie Vastel, Le Devoir, à vous.
Oui, bonjour, M. Trudeau. J'aimerais vous amener sur
Mr. Trudeau, I'd like to hear you on
le sujet du Parlement.
The topic of the House.
Depuis maintenant 3 semaines.
The activities have been suspended for a few weeks. The opposition parties feel a bit pushed aside from the democratic process. And let me remind you, you're in a minority setting. But what do you respond to those who say that you are deflecting away from the opposition parties and you're governing alone? On the contrary, that's why we're bringing the House back to debate on legislation that is extremely important for workers and businesses with the salary subsidy. And I'm looking forward to see the House resume in reduced capacity in order to continue our important job for us parliamentarians. But at the same time, we need to underline that many parliamentarians across the country who have been elected to represent their community and cannot come to the Parliament in this reduced setting, in particular setting, and that's why we are looking at ways, very seriously, we're looking at ways to gather Parliament in a virtual fashion. We know that it's important to allow our democracy to continue to function fully, and that's why by giving the opportunity to every MP, and not only those who are close to Parliament or have the capacity to come here and represent their citizen, and we will continue to work on this in the days and weeks coming. On this idea of a virtual parliament, what's the model you prefer? You would be there and there would be a question period, and would you be there every day, or something more flexible because in this time of crisis you might have other stuff to do? There's many good ideas circulating right now to see how we can make those institutions workable in this time of crisis. I think it's even more important than normal time that we have strong institutions and strong parliament in a time of crisis, and that's why we are working with other parties and with our institution and experts in parliament to see how we can continue to that people can have trust in us, that our parliament works and our democracy remains strong even in an exceptional context like this one for everyone.
Important that we continue to strengthen our democracy even during a crisis, especially during a crisis. That's why I'm looking forward to seeing Parliament reconvene in a reduced state in the coming days to be able to pass important legislation that's going to get wage subsidies out to employers so people can continue to hold their jobs even in this time where very few people are working. But more than that, we have to look at ways of virtually convening Parliament so that parliamentarians from across the country who were elected to do their jobs of representing their citizens in normal times and in times of crisis can make themselves heard. It can't be just about folks who have proximity to Parliament or the ability to get here. We need to look at ways that our democracy and our institutions can stay strong and embody and fulfill the functions that Canadians need them to. That's why I'm very much looking forward to discussions with other parties and experts on how we can continue with our institutions even in this difficult time.
Bonjour, Monsieur le Premier ministre. Christian Noël de Radio-Canada. Je n'ai pas changé de nom de famille encore.
No, I haven't changed my family name here.
La prestation canadienne universelle pour d'urgence.
The Canadian emergency benefit, many people fall between the cracks of the floor here, and they're wondering how long will they last? And the question is, what change will you make to change what crack in that floor, and will it be retroactive? We're currently looking at many type of people who are, effectively, falling through this net of the Canadian emergency benefit. Some people have seen their working hours massively reduced and continue to work. Should have access to this Canadian benefit. And we're talking about people maybe working 10 hours per week, maybe to make maybe $500 per month, and should still have access to the Canadian benefit, the emergency benefit. And in the days coming, we will announce how those people will be able to apply to get the emergency benefit. We acknowledge also that in certain sectors, including, for instance, the home care shelters, some workers are making less per month, doing an extremely important work for society, but make less per month or earn less per month than what they would make staying at home and get the Canadian emergency benefit. We want to make sure that those people who are doing such an important work continue to do it, but we're looking at ways how to give them a little bit more money so that it's worth it to stay at work, that are essential places. And of course, we'll have more to announce in the days coming on this.
The Canada Emergency Response Benefit is there to help millions of Canadians. We've moved quickly on it to try and help as many people as we possibly can, as quickly as possible, and that's rolling out today. But at the same time, we recognize that there are groups of people who aren't benefiting from the Canada Emergency Response Benefit who probably should. I think specifically of people who've seen their hours reduced massively down to 10 hours a week or less, maybe making a total of $500 a month, who are in a precarious situation, who really would and should benefit from the Canada Emergency Response Benefit. So we're going to be announcing in the coming days how people in that situation will be able to apply and receive the Canada Emergency Response Benefit. Think of other groups of people who, perhaps people working in long-term care facilities or seniors' residences who do extremely important work, particularly these days, but who actually don't make as much per month as they would if they had lost their job and were receiving the response benefit. That's why we're looking carefully at how we can increase their pay a little bit so that they do better off remaining at work rather than receiving, going off work and receiving the emergency response benefit. These are fine tunings that we knew we would have to do because in any program you're trying to help as many people as possible. There will be exceptions that we have to fill, and we're going to keep working to make sure that we get this right and get everyone the help they need.
Pour ce qui est des petites et moyennes entreprises, parce que la croissance économique.
Regarding the small and medium-sized businesses, because the economic growth plan for the second quarter will be not a growth, but a dip. And we know that those companies are the drive of the economy, and the subvention or the subsidy announced is not making them happy. What can you do to stop the dip of the economy, and what will you do to adjust it? We're in a situation where what we need to do to counter the crisis the health crisis is going against our economy and creating a crisis in the economy. But that's the choice we need to make. We must stop almost completely the economy in order to get through this health crisis as quickly as possible, in order to get back to our economic drive or this economic engine to get back to work in the coming months. To get through those tough months, we are currently giving direct help to the businesses and workers in order to last for those tough times. With the salary subsidy, with the loans and credit that is accessible to small businesses, and with funding for the larger companies also available, we are there to make sure that when the economy will start again at the end of this health crisis, we will be in a good situation and we will be able to get back to the economic activity before this crisis started.
Hi, Prime Minister. Tom Parry with CBC. I just want to return to that City News report about the shipment of masks. Did the United States block that shipment of masks to Canada? Are you aware of any other shipments that have been delayed or blocked? And you said that you expect the shipment to arrive. If it doesn't, what are you going to do?
We continue to have constructive and productive conversations with officials in the American administration who understand that essential services and supplies are very much a two-way street between Canada and the United States. We are interconnected and interlinked in so many ways, from primary resources flowing to American companies to make the equipment that is so desperately needed both in North America and around the world, to actual shipments of products that go from Canada to the United States, that go from the United States to Canada. We will continue to work together. We're going to make sure that goods and services that are essential continue to flow, and I expect those shipments to come in soon. Okay.
We know that the essential goods and services are going on both sides of the border. We will continue to work with Americans to make sure that those necessary goods to protect Canadians come into Canada, and we trust that they will come.
I'd like to ask you about masks. The Centre for Disease Control in the United States is recommending that people wear masks when they go out in public. Canada hasn't gone that far. Why is there a reluctance on Canada's part to make that kind of recommendation, given that some healthcare experts say it's a good idea?
I'm not going to make health recommendations to people. I don't think politicians should be opining on health solutions or fixes. I know that Dr. Tam is going to be sharing new reflections on masks in less than an hour now, and I encourage people to continue to listen to her and to health experts and professionals on how best we can keep ourselves safe, how best we can keep our loved ones safe, how best we can keep our healthcare workers safe at this time.
Brian Mullen, Global News. Prime Minister, some of the countries that have had the most success flattening the curve, such as Germany, attribute that to testing. So why aren't we doing more testing? Is it lack of people to administer the tests, lack of testing kits, or a lack of resources?
Every single day we are doing more tests than the day before. We recognize that large-scale testing is a key element of flattening the curve and dealing with the long-term prognosis of this pandemic. We will need to continue to test more and more to get those answers back quickly and be able to monitor the spread of coronavirus through our population. That's why we're continuing to do more tests. That's why we're creating more test kits. That's why we're continuing to develop new solutions on testing. Testing will be an essential part of how we get through this.
We acknowledge that those screening tests are essential to get through this pandemic. That's why every day we do more. That's why we are currently obtaining new tests, a larger amount of tests, and tests that are done in a quicker fashion and more easy, because to get out of this, we need to do massive testing.
Be delivered to the provinces so that testing can ramp up.
We've already had deliveries of testing kits, and we will continue to deliver more and more testing kits from around the world, from companies in Canada that are developing them. We know there's a need for more testing kits, and that's what we're working on.
Prime Minister Kevin Gallagher with CTV National News. We're hearing that healthcare professionals, nurses, doctors are being told by hospitals on border towns, specifically Windsor and Sault Ste. Marie, they have to choose between which institutions they're going to work at. They can't work both in the United States and in Canada. Should Canadian healthcare professionals now have to make that choice to reduce the rate and potential contamination of cross-border work that they might do? Should they choose to either work in Canada or the United States?
Provincial premiers and mayors are making extremely difficult decisions and are choosing to do the right things to both protect their own citizens, their own communities, and continue to help our neighbors. We need to get that balance right, and it is going to require some difficult choices. But we know that an essential part of this path forward is not just keeping Canadians safe, which needs to be our top priority, but also helping the world deal with this global crisis, and that's what everyone's trying to do.
We acknowledge that our provincial premiers and mayors across the country, but particularly close to the border, are facing very tough decisions. Their responsibility, their first responsibility, is always to ensure the health and security of Canadians. But at the same time, we acknowledge that we are facing a global situation, and we must be there to help our neighbors if we can.
I didn't really get a answer to that question specifically, but I need to move on because there's another answer here that we're looking for. From this report that Premier Ford's talking about with this shipment that was blocked yesterday, are you aware of shipments of personal equipment for protecting medical personnel or any other type of shipment that has been blocked by the United States?
We have recognized over the past weeks a number of situations in which shipments coming from different countries around the world have been delayed, haven't arrived with as many products as we were hoping to see. This continues to be an ongoing problem, but specifically with the United States, we are working with them to ensure that the orders that Canada has placed get delivered. We expect those shipments to come.
We acknowledge that it's a reality across the world, that some expeditions have less equipment than what we wanted or being delayed because of actions by different countries across the world, but we will continue to work to make sure that Canada will get all that we need.